Welcome to Brain Wellness, the podcast. I'm your host, Mandy NP. Each episode will bring you a new topic or interview related to brain health and wellness as part of my mission to help you on the path to a healthier, happier brain. So, let's get started. Hello, everyone, and welcome back to another episode of Brain Wellness, the podcast. My guest today is Dr. Njideka Olatunde. Dr. Olatunde is a visionary and creative energy behind Focus on Healing Wellness Institute. She is an accomplished naturopath and a leading authority on the cultural integration of traditional health practices with conventional medicine for mind, body, and emotional wellness. She is an author, acclaimed speaker, podcast host, master reflexologist, pain relief educator, and consultant who has helped thousands of chronic pain sufferers relieve pain first with addiction and medication-free pain relief treatment using the power of touch and reflexology as an alternative to addressing the opioid epidemic. Thank you so much for being here with me today.
Thank you for having me, Mandy. And I'm looking forward to sharing with your audience.
Yes, I'm interested in this conversation. I haven't really talked to anybody about reflexology. I've heard about it. So I'm really interested to hear what you have to share with us today. I always start off, my first question, though, is always, tell me a little bit about your backstory. How did you get to what you're doing today?
Okay, let me see. How did I get started? It's a combination of a lot of things, so I'll kind of bring us through it. Mm-hmm. I grew up originally as a child on home remedies. And so when I was growing up, doctors in my eyesight as a child, I saw as healers. Like, they lived in our neighborhood and they came and did home visits and people got well. I said, oh, wow, that's what I want to do when I grow up. So by the time I got to college and looking at medicine, I said that was not going to work for me. So I changed careers and went into social work. So the bulk of my work experience was as a social worker. But as a social worker, one of the things that really concerned me was that most of the clients were always going to the emergency room for their doctor. And I said, something's wrong with this. What happened to the prevention? And so that kind of sparked my desire again to go back into, I want to be a doctor. And so at that time, what was really happening, that's when naturopath and alternative and complementary healthcare approaches was opening up. And I said, okay, so I went back to school and I said, okay, now I can do this. But while I was practicing, I wanted to add a service and I didn't know exactly what service. So I had spent some time doing research on my ancestry, and I have Native American as well as African ancestry. And I knew I had spent some time with honoring my Native American connection. And we did what was known as what was called a vision quest. And I had to go sit on a mountain. And the quick story behind that is, remember that I come from an urban environment. I didn't know anything about outdoors and living in nature and all of that. So that was a whole nother experience. But while there, it gave you a time to tune in and connect with yourself. And afterwards, all of like the animals or the insects that you saw that stayed in your area, they did a translation. So for me, they said, you need to be working with your hands. You need to do something with your hands. And so, okay, I thought that meant massage. So when I went to massage school, I did not like that. So I got turned on to reflexology and I liked the reflexology and I added that to my practice. And that's what I was doing. And I've had the opportunity to train locally, nationally, and internationally in reflexology. And I have focused specifically on that. And so that's really kind of like, my background. Now, when I originally started working with senior citizens. That's how I got started in reflexology. And from working with them, it added to their families and other things. But I say that to say, working with the seniors and working on their feet and hands, that was my introduction. And I'll tell you this little tidbit here. If you know anything about seniors, you have to be real focused when you work with them. And when you say you're going to do something, you have to do it. And it's nothing else. So they said, well, I like you working on my hands and my feet. Can you now start caring for my hands and feet? That opened up a whole nother arena. So that put me into the beauty industry in terms of learning how to do manicures and pedicures. And that was started by the seniors. So then I started adding the reflexology to manicures and pedicures. But I didn't know anything about the beauty industry. And what happened, because my training originally in reflexology always came from a health perspective. And so with that, what originally happened was there was a school that was from the West Coast that came to the DC area and was doing a program on integrating reflexology in the beauty industry. And so from there, I said, okay, well, let me go. And that was in New York. I said, let me go take this program to see how to put it together. When I did that, they said, well, since we're here on the East Coast, can you put together a training program? We'll come down to DC and do the program. Had never done anything like that before in my life. Called all my massage therapy friends, put this little class together and did the program. And from there, I wound up becoming the East Coast instructor teaching reflexology in the beauty industry. And that evolved into what happened was, could I do a program related to reflexology and health? And from there, Focus on Healing started teaching reflexology to healthcare professionals and in the health industry and all of that. So that's my little quickie story on my evolution in reflexology and what I do. But up to date, I've been spending most of my time doing research with reflexology, specifically as it relates to pain and using it as an alternative to the opiates.
Very cool. Very cool. What a diverse background to get you to where you are with that. So my next question that I want to ask for any listeners that might not have heard of reflexology before, can you give a quick explanation of what, or maybe not so quick, just a good explanation of what exactly it is, and how you might use it?
Okay, reflexology by definition is the art and science of working specific reflex nerve ending points that are found on the hands, the feet, and the ears. And to give an understanding of what that is, if you ever look at a chart of the anatomy and look specifically at the nervous system, you'll see how all the nerve endings begin in the head and run straight through your body with ending points in the hands and feet. So what a reflexologist does specifically when they are working on the hands and feet, those nerve endings, you're looking for stress, and we call it stress. It's stress areas that are blocking circulation. And when you understand, so I can give a kind of a picture for your audience to understand how reflexology works. Think of an electrician. When your power goes out, and because you're young, and this doesn't apply to you. In the old days, if the electricity went out, we had something called a fuse, and you'd have to go screw a fuse in the box, and the electricity would come on. Today, we have circuit breakers. I know nobody's heard of that, circuit breakers now. And that would put the electricity on. But if that didn't work, you had to call an electrician in because that meant that something was wrong with the wires. And that's the same concept in terms of how a reflexologist works. We're working on the wiring, making sure that the circulation in the body is flowing effectively. Because when you understand the nervous system connects directly to the brain and sends, it's like your communication. It sends the communication to all of the system cells and organs of the body. And that's what we do. We keep the lines of communication open. Now, here's an example of how reflexology works. And I say this to say that everybody listening has done reflexology and you don't know that you have done it. Everybody knows it because we all have the power of touch in our hands to be about bringing about healing. And here's an example. So Mandy, think about this. When you hit your elbow, what's the first thing you do?
Grab that elbow, you kind of pull it away.
But
Right?
before you grab it, you hit it. What's the first thing you do?
Probably say ow. I don't know.
That's it. Verbal release is the first thing. Impact, verbal release. Then message goes to the brain. Trauma in the elbow area. Then what's the next thing you do?
Then you grab it.
Then you rub it. As soon as you rub it, message goes to the brain. Release the body's natural healing, which we call painkillers, to that area. That's what that rubbing does. And so what it is, you're releasing endorphins, your body's natural pain relievers. And then after a while, you start feeling a little better. And so that's the concept in terms of how reflexology works. Now, let me share a little information that everybody may not know. We've all heard about what? This little piggy. You remember this little piggy? And when you do, think about that now, especially when you do it to the little babies you did. That's usually the introduction. You do this little piggy and you start going through each of the toes, circling each of the toes or to share this little piggy. Well, guess what? That's your first introduction to reflexology, because what you have done is stimulated the nerve endings, because the fingers and the toes are the nerve ending points to the head. And what happens when you started doing those circling the little toes, the baby starts relaxing and calming down, smiling, feeling good, and may even go to sleep. You've activated that nerve. That's the reflexology. That's the process in terms of what we do when we're doing a reflexology session.
I would never have thought of that example, but I love it. That's it's a very understandable way to see how that works. I love that. How is that different from like acupressure when you're just pushing? So is it more of the movement than just the pressure?
Okay, the difference between the two is acupressure is an offset of acupuncture, which means you're looking at specific points on the nerve endings that you're activating. So when you're doing acupressure, you're doing specific points, which is pressure points on a particular area of the nerve ending throughout the whole body. In reflexology, we do a technique which is like a walking technique, that we use our thumbs to walk, like we're walking the nerve ending on the hands and feet that has a location. Say, for example, if I can kind of show you, say like the thumb here. This right here is the nerve ending to the spine. So if somebody had a back problem, I'm going to take my thumb and I'm going to do a walking motion up my thumb area, which is the nerve ending to the spine, in terms of relieving stress and pain that may be going on in the back area. So what we do is you find the specific area of the problem on your hands, feet, and ears, and you do what's a walking. And so it's like you're following the nerve ending. You're going up and down the nerve ending. And that's the concept. So that's the difference. So it's not so much as it pressure as it is stimulating the nerve ending to be about releasing toxins, relaxing the body, improving circulation, and relieving pain.
Gotcha. Gotcha. So how, and you kind of touched on it a little bit earlier, but how is the power of touch so important in relieving pain? How does it work to actually relieve the pain?
Okay. The reason why I stress the importance of using the power of touch in relieving pain is because when you think about it, touch is not just physical. See, that's what we have to understand. We have to separate our understanding of touch as being physical. Touch is also mental. It's also emotional, as well as being physical. So, in other words, when I say touch, in my practice, the first thing I do is I do the first touch called listening. When a person goes to the doctor, the reason they're going is because they are in pain. And the one thing they want is what? Pain relief. So, in order to relieve the pain, what usually happens, the doctor's going to say, well, where's your pain? And you tell them where the pain is. And then they say, well, then the next thing is I say, well, we got to do some tests to find out what's going on. Then after that, well, here's a prescription, to help you with the pain. But you don't know what the pain is. You don't know where the pain is. You don't know what's causing the pain. And the fact of the matter, when you talk about stress, is the number one contributor to your pain. And so I always say, give your clients what they want. When you go to the store, you know you want something specifically and you go to do that. The same thing needs to apply to us in the health industry. We've got to start giving our clients and patients what they want. So the first thing I give them, which is the power of touch based on listening, I just sit there, let them tell me what's going on. And by listening, I connect to what is a contributor to your pain problem. And from there, they've got to talk through it. And then I'll make some suggestions. Then we can move to, okay, now let me show you what we can do to relieve the pain using reflexology as the power of touch technique. So when I do that, all of a sudden, they're beginning to feel better. They're beginning to feel the relief from the pain. Now I have client patient willing to work with me as we put the treatment plan together in terms of what's going on inside your body that's causing pain. So throughout the whole process, we are touching. I'm listening. I'm putting my hands on you as well as I'm talking to you and acknowledging you. Those are all touching points in terms of relieving pain and stress.
Mm-hmm. Through the use of reflexology, are you able to then get people off of their pain medicines?
It has happened because we're talking about the number one thing that people don't want to deal with is mindset. Because when you think about it, if you're in pain, it did not just happen overnight. It was a process. It's something that happened outside of your body that you brought inside and start internalizing. And when you internalize, it manifests into whatever the weak area is inside your body that wound up becoming a health issue. And so what we do is we're focusing on mindset, getting you to think differently so that you are now taking back control of how your body heals. You're also taking back control of how I relieve pain without using medication and strengthening my body. So now I get back to focusing on prevention, which is something we don't talk about anymore. Back in the day, we were talking about prevention. That's a word probably nobody even remembers that it even exists. But we've got to get back to prevention. And prevention happens through self-help care.
Mm-hmm. Mm-hmm. How do you get clients to buy into this idea of using reflexology, either in addition or instead of other means of pain management?
Well, one of the things that I focus, I wrote the book Reflexology Today, A Family Affair. And when I wrote the book initially because I had this feeling that it's a family connection. And when I wrote the book, I was on my way to China to study reflexology. And when I got to China, I got a confirmation that I was on the right track. Because in China, what happens is the doctors spend anywhere from an hour to an hour and a half with their patients before they even start any kind of treatment. And then what they do is they put together a treatment program that's based on prevention, which means is if the patient comes in with a health problem, now we're going to bring the whole family in. We're going to talk about this health problem, and we're going to look at how do we put together a preventive treatment plan for that includes the whole family, so the family does not have this particular problem. And I integrated that concept in terms of I bring the whole family in because we're talking about your health problem is not just isolated to you. It's the whole family is involved in this. So we do this from the standpoint of it may involve a young person showing them how to do some reflexology points so you can now do it on your mother, your father, your grandparent, whoever it is that I'm working with. So now it's a family project. And with that, now you have a self-help tool. And I say it from the standpoint, now you have your reflexologist inside your family working with you 24/7. So that's the whole thing. It's involving the whole family or friends or whoever's in your environment, including all of them in the healing process.
It seems like that could take some time. How long does it take to work with somebody to get them through the process of learning this technique and utilizing it on a regular basis?
Well, basically, it's not as long as it may seem.
Okay.
You may not know where the particular nerve ending is. Say, if you're having a back problem, you may not know specifically where the nerve ending is on your hands and feet. But guess what? Just doing stuff, walking your thumb over the whole palm of the hand and those kind of things, because you're activating what's known as the body's natural pain relievers, which will automatically go. So it's about getting you to start touching your hands and your feet and getting in the habit of doing that. Then we start customizing it based on your particular health issue. So that's the initial concept in terms of how we get our patient clients started in the process. It's about touching yourself. It's about understanding. I do this one little thing here is we don't know our bodies. We don't understand our bodies at all. And the thing about it is we know more about our automobiles than we do about our bodies, and understand that the automobile is a carbon copy designed just like the body. It functions just like the body. And so what I do, I tell when clients come to me and they give me a diagnosis, we look at the health system. What's the body system? So say, for example, if somebody came to me with asthma, I'm going to ask them, well, what body system or what organ is connected? And they start talking. So now you start seeing the process. So which means that the number one thing we got to do is, if you're talking about you had asthma, you're looking at the lungs, you're looking at the chest, you're looking at the respiratory system. So that part of the body is saying, I'm stressed, I need help, and I need you to do something about it. So that's how, I deal with them in terms of getting them to reconnect with their bodies. So now we're changing the whole mindset in terms of this is how you take control. So yes, it's a process, but it's got to be a communication. And I say that to say is, I'm not the healer. What I do is I work with the body, assisting it in the healing process. And it's about you as the patient client. We are together working with the body to bring about its natural ability to heal itself.
Mm-hmm. And that's something we don't often think about. We look to medications, we look to surgeries even sometimes to fix things, and we don't often think about the fact that our body was made to have this level of homeostasis, keep
Yes,
everything trying to as straight as possible, but we don't give ourselves the chance to do that. We do everything to try to stress ourselves out on a daily basis.
exactly.
So it's taking back some of that control. That's good. Is it as effective if people do the movements on themselves as it is if somebody else were to do it for them?
Now, this is the key. You can do the relief on your hands yourself, but with your feet, it's difficult. And I say that is because of how you have to position your body, and that puts stress on your spine. So in order to, when it comes to the feet, it's best to have somebody work on your feet. But you can do those same techniques on yourself, as I call self-help care, on your hands. So that's the difference.
Okay. Okay. And then I'm assuming then kind of like with acupuncture, acupressure, there are certain points that you would want to do the work on depending on where in your body you're having issues, where those nerves travel to.
I love that question. And the reason why I say that is because that's the way allopath works. They work on taking the body apart in
Mm,
terms of, okay, this is the area that's stress, this is the area where the pain is, so we go in here. But that area that's in pain is not necessarily the problem. The pain, that's just the outlet for the pain to be about releasing whatever toxins or impurities. It's not, in other words, when you think of pain, you need to think about toxins and impurities in an area that's not the formal way you release toxins from the body. And so, which means it's in a joint, it's in a muscle, and it's trying to come out. And since it can't come out, it creates pain. So in reflexology, always you work from head to toe. You cover the whole body because you don't know where that area that's the corporate of the pain is. And so you just don't want to focus on the pain area. You want the whole body. And so in reflexology, we do head to toe on hands and feet.
that's a really good distinction, actually, because we do tend to think of what exactly it's doing. And I can kind of compare that to where I'm working right now. We do laser treatments on people. And
Yes,
I have seen some laser treatments being done on the area that the patient is having pain, but that's not always where it's coming from. And
exactly.
so I've had lots of conversations with people about maybe moving to a different area, and we might even have to do laser on the brain because all the nerves come from the brain, and then you get helpful
Yeah.
in other areas. So I can completely get where you're saying with that, and it makes so much more sense now when I think about it that
Yeah.
way. So yeah. How do you then integrate this as part of just helping somebody heal in general?
Basically, I always tell my class, whatever is your stress, whatever your stress is, be it mental, be it emotional, be it physical, the power of touch is what brings you the relief. And I say that because, say, for example, if someone is dealing with an emotional issue, just being able to relax and release using reflexology helps the mind to be able to start seeing and helping you feel things a different way, and you feel refreshed. That's the way reflexology can work. Say, for example, you got to make a decision about something. You got a mental issue that has to be addressed. You're depressed and you need to have your energy level lifted so that you can be able to functioning. Reflexology can help with that because now we're focusing on how do we get get you out of a stress, depressed, anxiety state by calming you down. Because see, the key that people don't understand, the body can never, no matter what your problem is, heal itself or relieve itself until it's in a state of rest and relaxation. You have to have that first before you can deal with any type of treatment or any kind of relief that you're looking for. And that's where reflexology comes in. And I also say that there is no one therapy that can do it all. We have to start thinking integrative. We all work together. Each has a different and specific purpose. And I always include that. My focus with reflexology is addressing pain first. Then we're going to look at what other therapies and approaches can we use that will help you get to what? Maintaining optimum health and wellness so that you can always get back to being in a preventive mode.
Mm-hmm. Mm-hmm. How many, trying to figure out how to ask this. How many sessions does it take for people to start noticing a difference? Will they notice something the first time?
Usually, within the first session, you'll start feeling its benefits. I usually recommend about 5 sessions, and then we start tapering off to maybe where you may do it 2 times a month or something, where you incorporate it as a wellness maintenance piece. But I say about 5 sessions, so then we can move with integrative therapies, because I may find that you're in pain, but it's because you may need to have a lymphatic cleansing. So that means I need to look at I also focus on what are the hands-on medication-free alternatives that focus in that particular area. That's their discipline, that's their modality. And then we do the integrative approach.
So still trying to keep them in a more natural way to get rid of
Yes.
that pain.
Yes.
Yeah.
Yes.
Yeah. I love that as well. So very good. And for the sake of time, I guess I'll kind of move on to my next line of questions. I have so many other thoughts. I'm trying to get them all straightened out, and sometimes I might have too many thoughts, and I can't figure out which one I want to ask first. Do you have any upcoming events or projects or anything that you would like to share with our listeners?
Well, one of the things I really would like listeners to understand is that we have to work together in terms of getting our mindsets back in line with using touch and being open to touch. It's about changing. So what I do is I do have some workshops. I do have some information, downloadable information that I share to help. I am available for people to talk about their particular health problems where I do, consultations. So I have those programs. So consultations, self-help guides that I have available in terms of working with people to understand how they can effectively use reflexology. Those are some of the projects I work on. I also do a program where I teach and train young people between the ages of 16 to 18 in terms of how to become reflexologists. And I do that purposely because young people are probably the most stressed of all of the population right now. And nobody is looking at showing them stress and pain relief alternatives. And reflexology, I use that as a way to show them how they can do some basic things with their hands in terms of relieving stress, and even looking at it as possibly a career opportunity. So those are the things I do that I really focus on. It's about being able to pass it on to the next generation.
Very cool. And I'm assuming with this being more hands-on, it's going to be like a local thing, or can you do this like on a Zoom or
You can do it
virtual?
virtually. It can be done virtually. And I do, and my practice is virtual. And the
Okay.
reason why I say that is because that allows more one-on-one. Because when you're doing it virtually, I'm watching you use your hands. I can direct you. I can I can focus on where you need to be in a one-on-one sitting based on your particular needs. So yes, virtually, but I guess because of the pandemic, it moved us into that arena in terms of how to be creative and help people to be able to still heal themselves in the ways of virtual.
Yeah. I'm always fascinated how we have all figured out how to do these things over a Zoom like this, or
Yes.
how we figured out how to do these things virtually. I taught nursing school during the pandemic as
Yeah.
well, and trying to teach students how to do assessments on somebody. We had teddy bears out and everything to try to find some landmarks that they talked me through, but we did what we had to, and I'm
Exactly.
glad that it still works for you to do this that way. Yeah. How can people find you if they want to learn more about any of these techniques or your workshops or whatever?
Okay. You can visit my website, which is focusonhealing.com. Information is on my website. I do host a podcast where we talk about different things. It's the Touchology Wellness Experience.com as well. So that's like, how you can connect with me. And also I share with your listening audience, when you go on my website, if you have any particular questions that you may want answered, by all means, contact me. I'm available to help you out and answer those questions because I want people to start taking back control using the power of touch.
Mhm. And I will include those in the show notes so people can find you and they don't have to try to write anything down in case they're driving right now.
Yes.
Yeah. Any last little tidbits or words of advice you'd like to leave with our listeners as we close out today?
Before I close out, there's one thing I want to share with you. In the African tradition, when you visit someone's home for the first time, you bring a gift. And I have a gift for you and your listeners. And that gift is medication and addiction-free pain and stress relief poster that I am giving to your listeners that they can download by going to touchology.reflexology.com. So that's a free download with various alternatives that you can find in terms of relieving pain and stress for your listeners. And the message I leave with everyone is that understand that it is your right, and I say your birthright, to take back control of your life from any pain or stress that you're in, and know that you have it in your hands using the power of touch, because the power of touch is what heals all.
Thank you so much. Thank you for the gift. Thank you for these final words. And thank you for joining me here today, Dr. Olatunde.
Well, thank you for having me. My pleasure.
Thanks for tuning in to this episode of Brain Wellness, the podcast. If you enjoyed this episode, I encourage you to subscribe, like, and share this with others to help me continue on with my mission to help people live healthier, happier lives. Go to www.brainwellnesssolutions.com to see what I'm up to and get links to all the social medias there. See you next time.